ain't need to hire me. This teeth looking alright.
I guess I'll ask which toothpaste you use. Internal medicine and family medicine are two specialties in the field of medicine that provide the most physicians into primary care. Today I have with me here my colleague in the field of medicine. We went to the same school and we're all doing well in life. Her name is Dr. Pryce. There'll be a time that I'll give her the chance to introduce herself. But this video is for the one that wants to get more information about family medicine and internal medicine, wants to know the difference. Also for those applying for residency this year. To my new subscribers, thank you for joining this platform. Here we talk on faith, principles, and medicine. And my name is Dr. Frederick Acquah. Currently, I'm a third-year internal medicine chief resident in New Jersey, and I hope you find this video helpful. Let's go. Welcome back. So like I said, we have here my colleague, Dr. Pryce. I'll allow her to introduce herself.
Hi, everyone. My name is Dr. Pryce. I'm a third-year resident in family medicine here at a hospital in New Jersey. I'm excited to be here. Hopefully you guys find this video helpful and resourceful.
Okay. So we want to know more about you in terms of your education. How long would it get for someone to become a family medicine doctor? So where did you go to school, and how many years does it take to become who you are today?
Yeah, that's a good question. So I first, of course, went to college. So I did 4 years of undergrad. I went to the Pennsylvania State University, where I majored in life sciences and I minored in human development and family studies. After that, I took a little break. During that time, I took 2 years off. I was studying for the MCATs, which is the medical admissions exam to get into medical school. And while doing that, I also worked part-time as well. So during my 2-year gap, I was applying to medical school. I went to the American University of Antigua, College of Medicine in Antigua and Barbuda, West Indies, where I had the pleasure of becoming friends with one of the most awesome doctors ever.
Thank you.
Dr. Acquah. My school had a dual MD, MBA program with Urbana University, where I was able to actually get my MBA. It is a master's in business administration with a concentration in healthcare management. So while studying for my medical degree, I also took courses online for my MBA as well. Then after that, during your last year of medical school, you'll start applying to residency. So residency is your training. So whatever you find interest in, you can apply to that program. So if you're interested in surgery, you'll apply to surgical residencies. If you're interested in internal medicine, like my friend here, you'll apply for that. I was interested in family medicine, so I applied, and I'm now in my 3rd year.
So to me, I knew during my clinical rotations that I could not, and I didn't feel comfortable taking care of kids. So family medicine could have also been a nice field for me, but then I did not like taking care of kids. So I knew family medicine wouldn't be it. So in my opinion, that's how internal medicine came into the picture. And so far, I've been enjoying my medicine rotations in the subspecialties, and also with me getting ready for my attending year, hopefully next year. So to Dr. Pryce, the question here is, why family medicine?
Okay. So why I chose to specialize in family medicine, I enjoyed giving the continuity of care, or providing continuity of care. I see people of all ages, from newborns all the way up to geriatric population. I also give care to pregnant women as well. So that was something that drew my interest into family medicine. I get to work with a diverse background of patients on a daily basis. I also enjoyed the flexibility that family medicine provided. I prefer working in an outpatient setting, such as a clinic or a private practice, but in family medicine, I can also work in the hospital as well. So that was another thing that I was looking for in terms of what I wanted to do post-residency. And last but not least, the schedule. I didn't want something, well, as you know, medicine in and of itself is demanding, but I also wanted a specialty that provided me with a good work-life balance, and I felt like family medicine did that for me.
You want to, let's say, focus more on the hospital, I will recommend you do internal medicine. If you want to focus more on outpatient stuff, then I will recommend you do family medicine. But it's all up to you. What Dr. Pryce said, depending on what kind of patients you want to be dealing with. Like I said, I didn't want to be with kids, you know. She also sees most female patients with OB-GYN and do some minor surgical procedures. So I don't get to do those stuff, you know. So depending on what you want to do. And I did publish a video, I think 2 videos ago. You can see the link right here on what's next when it comes to me and what my life will be after I'm done with my internal medicine residency. In that video, I went into the subspecialties of internal medicine. So now the question that I want to ask Dr. Pryce is, what are the subspecialties in family medicine?
That's a great question. So again, that's something else about family medicine that I truly enjoy is the broad spectrum of things that we can go into. So some fellowship programs that FM residents can do after residency are things like sports medicine, sleep medicine, adolescent medicine, maternal health as well. The hospital I work at has a fellowship in obstetrics. So if that's something that you're interested in post-residency, you can do that as well. And I also want to remind viewers that it's okay to change your mind. It's okay to, you know, go into a residency program thinking that, okay, once I finish here, I'm gonna work in a hospital. That's all I want to do. You know, life happens, things change. When I started my residency, I had a strong interest in women's health, and I was looking to do a fellowship in obstetrics after completing residency. And now, in my 3rd year, I've completely changed my mind. I'm no longer interested in obstetrics as much as I was prior to going into residency. I'm grateful that my residency program does provide us with, we have like a heavy OB schedule. So I'm able to assist with C-sections, I'm able to assist with deliveries. So that's exciting, but I realized that me going into it a little deeper isn't for me. I'm good with where I'm at.
Okay. When applying to family medicine, do you need much research experience?
Thinking about my application, I don't believe I had a lot of research experience, but you want to keep your application to be as competitive as can be. So I feel like if you have the opportunity to do research, do it. Get your name out there. If you can get a publication, that's also awesome as well. I also recommend you getting involved in your community. Residency programs like to see how you're involved with your local community, what community services you have been a part of or that you help run. So things like that, as well as, of course, having good grades. That's number 1 on the list.
All right, well, that's true. African Americans are not much represented in the field of medicine. What will be your advice to the young male or female watching you, especially the females watching you? What will be your advice to them when it comes to pursuing their dreams in the field of medicine?
Yeah, I would definitely say get an advisor, especially someone that's in your field that has already gone through what you've been through, so they're able to guide you. I know my advisor when I was applying to residency, she helped me with the application like tremendously. There was typos, there was all types of grammatical errors. You know, I wasn't conveying things as well as I could. So find someone that's in your field or the field that you're looking to join to be a mentor. That would be my number 1 advice. And then my other advice would be to be involved. So definitely show that, you know, medicine is something that you're passionate about. Last but not least, I would definitely say study hard, work for it. Medicine is a challenging field, but it's also rewarding. It's rewarding to, have a patient. I'm now in my third year, but I find joy in providing care, but also providing care to patients that have been with me from my intern year. When I was just starting out, there were things that I was like, I don't know what I'm doing. I'm kind of confused here, but now it's like, in terms of just the way how I interact with patients. So now I can see my growth, and that only comes from working at it, putting in the time, putting in the effort, keeping up to date with new information. Things with medicine are always changing. There's different treatment plans that I don't want to say pop up overnight, but sometimes things change. So you just have to keep reading, keep working hard, and just keep putting yourself out there.
All along while I was growing up, it's always been my dream to become a doctor one day. When did the switch went off on you as to, oh, this is what I want to do, I want to become a doctor?
Mm-hmm. I would say in high school, my grandmother was a CNA for one of the large hospital networks in New York City, and I would spend time going to work with her, and I think that kind of drew me into medicine. Originally, when I went to college, I was like dibbling with law. I was kind of like, oh, I want to be an immigration lawyer, but like medicine was always in the back of my mind. I just didn't feel like I had the guts, so to say, to do it. But in the end, everything worked out.
Most people watching today would want to know what a typical day is like in a family medicine resident or someone in residency. So can you shed some light on what a typical day looks like in your field?
Yeah, sure. So as I said prior, family medicine, we are flexible. So some of us can be in the hospital. When we're in the hospital, we're on inpatient, managing the patients that are admitted to the hospital. So that schedule is anywhere from 12 to 13 hours. So it would be like a 7 to 7 shift. We can also be found on the obstetrics floor in the hospital, providing prenatal care, assisting with ultrasounds, assisting with deliveries, vaginal and/or C-sections. We can also be found in the clinics. So we have an outpatient clinic that's affiliated with my hospital. We serve mainly underserved populations. Most of our patients, I want to say 95% of them, don't have insurance. So in the clinic, we're there from 8 to 5, just assisting patients with their general chronic medical conditions. And then along with that, we also get placed in certain subspecialty rotations. We have rotations at the VA in GI, urology, as well as ENT. We also go to one of our other hospitals that we do rotations at here in New Jersey for our pediatric inpatient, ER, as well as outpatient. So that FM residents, we get exposed to different subspecialties so that we have a good understanding of how to manage patients with different chronic conditions.
Okay, so most likely it's like you're a medical student, but now you're a resident, because it seems like you guys have tasted every specialty, again, just to make you a well-rounded physician.
Yeah, and I think as FM residents, we have to be well-rounded. We have to know a little bit about everything. That's one of the downsides of FM as compared to another residency program like ENT. Ears, nose, and throat, they got that down pat. Anything regarding that, they'll know it for sure. But if you ask them something about the foot, you wouldn't go to an ENT physician for your foot complaint. Right, but you would go to your family provider if you have a throat complaint. You would still go to that family provider if you have a foot complaint. So we unfortunately for us, because we do have to be well-rounded and have a brief understanding of most things involving people's health.
As we bring this video to an end, I would want to give Dr. Pryce the chance to give any shout outs to anyone out there.
Huge shout out to my parents. I wouldn't be where I am without them. They have helped me move when I went to Pennsylvania for undergrad, when I moved to Antigua, when I came back to New York to then move to New Jersey. Like, my parents have been my biggest supporters, and I'm so grateful that they are here with me. They're alive, they're well, and they're able to see me grow and blossom into the position that I hope to be.
Awesome. Any closing remarks while we shut off the lights and the camera?
Study. That's my biggest thing. Like, medicine is challenging, but it is also rewarding. So if you do the work, you will succeed. Take care.
All right, guys, I hope you enjoyed this video. If you have any questions, please leave them in the comment section, and I will, or Dr. Pryce will see and answer the questions accordingly. If you enjoyed this video, don't forget to leave a like, and if you've not subscribed yet, what are you waiting for? Please subscribe. I'll see you in my next video. Shalom. Today, I have with me here my colleague in the field, Dr. Pryce. Don't worry, she'll be coming in very soon.
Hi guys, welcome back to Frederick Acquah's YouTube channel. My name is Shanae, and I'm his guest speaker today.
Wow.
How are you doing?
Good. Family medicine and internal medicine. Wow. Okay. Internal medicine and physical medicine.
I have developed my skills in terms of my medical knowledge. I want to shout out my mama. No.